I am honored to be recognized as a living legend at my church, Lynch Street, CME. I am Kay Killings Mayfield. I was born in Taylorsville, Mississippi to Jesse Lee and Annie Mae McGill Killings. I am married to Alfonso Mayfield. We are the parents of 2 children and 9 grandchildren. I have 2 brothers. My mother died when I was 11 years old, leaving my father to rear us on his own. I was brought up in Lynch Street CME Church, serving in many roles from childhood till I finished high school. I attended school at Smith County Training School, graduating salutatorian in my class. My childhood dream, ambition was to always to become a second grade school teacher. School teachers were the most important people I knew, with the exception of my parents and Mr. Charlie, who ran a store in the neighborhood. A recruiter from Mississippi Valley State College came to our little one-hall country school and talked to us about their nursing program. By the time she finished, most of the females in the class were persuaded to become nurses. This was my introduction to the field of nursing and the end of my dream of becoming a second grade school teacher. I was the first member of my family to enter the healthcare arena. However, my nursing career was nearly debunked a couple of times. The first was when, as a student, I was in on my first cesarean session in Taborian Hospital in Mount Bayou, Mississippi. The doctor made the incision, and I made it out the door. The second time was doing clinical at Greenwood LaFleur Hospital. The nurses' station was calm. Everyone was quiet, performing their tasks. Then all of a sudden, I heard chairs squeaking, floor scrubbing, the nurses jumping up, grabbing charts for the doctors, giving them their seat, being very subservient. I stood in amazement. What was happening? I didn't know it was like God had walked in. This almost ended my nursing quest, but I continued, not sure what I was getting into. Our next rotation was at Tuskegee VA Medical Center Psychiatric Unit. This was a fulfilling and enjoyable clinical rotation, making up for the other 2. After graduation, I worked at UMC on the Women's Health Unit and Pediatric. I decided to return to school, attending Meharry Medical College Nurse Practitioner Program in Nashville, Tennessee. I was extremely impressed with Meharry. All the tops, all levels, all managers, they were all black. The hospital, Hubbard Hospital, was new, top-notch, up to date, the best equipment. This small town girl had a sense of pride in seeing my people lead. I graduated and passed my board as a family nurse practitioner, and I received a Master of Science degree from the University of Mississippi. I was employed at Jackson Hines for many years. I started out working in the school-based clinics, including Utica Junior College and Hines ASH in Utica, Lanier High School, Rowan Middle School, Blackburn Middle School, and Brinkley. Also seeing Brown Elementary students at Rowan. I often see some of the students at events and enjoy catching up on their life journey. I still treat many of them as adults, and I've even treated some of their children. At Jackson Hines, I held other roles in women's health, pediatric, adult medicine. I'm currently working at North Jackson Medical Center Clinic as an office manager and nurse practitioner. I served as district and state president of Eliza Pillows Registered Nurses Association. I was appointed to the Mississippi Board of Nursing by Governor Ray Davis, the regulatory agency for nurses in the state, and served as the chairperson of the Advanced Practice Nursing Committee. I served for many years as a volunteer nurse through the Red Cross for Jackson State football games. I hold membership in National Black Nurses Association, the American Nurse Association, the Mississippi Nurse Association, and the American Academy of Nurse Practitioners. I have served as preceptor trainer for many nurse practitioner students, many of whom have excelled in the profession. I have embarked on lifelong learning, attending many nurse education conferences, local, state, nationally, and abroad. I have been presented with several awards, honors, and recognitions. Nursing is a rewarding profession. It's focused on the health care of individuals, families, and communities so that they may attain, maintain, or recover optimal health and quality of life. There are many areas available in nursing, from the staff nurse to the flight nurse and many in between. Nursing has been a gratifying, fulfilling, and rewarding profession, and though it was not my first choice for a career, I believe that God led me into it. And today, nurses are called heroes. And speaking of heroes, a fellow nurse received the title of hero way back then. Dr. Rebecca Lee Crumpler, born in 1831, died in 1895, was a nurse for 8 years before matriculating to medical school. Dr. Crumpler received the title of hero because of her bravery to be the first female African American physician in the United States, and she maintained dedication to caring and providing health care to the less fortunate. In 1983, Dr. Crumpler published a book of medical discourses. This book was dedicated to nurses and mothers. Dr. Crumpler's book is one of the very first publications by an African American physician. Her main desire in presenting this book was to emphasize the possibilities of prevention. And speaking of prevention, let's wear our mask, wash our hands, practice social distances, and take the COVID vaccine and be safe.